Associate Professor Kirsty Short never thought she would become a scientist.
My parents are scientists, so I always said that that's not something I'm going to do.
But whilst applying to study international relations at university, she was persuaded by her mother, renowned biologist Professor Marilyn Renfree, to do a science degree on the side.
I selected microbiology and immunology, and as of the first lecture, I was absolutely hooked. I knew that that's what I wanted to do with my life. And it was a really pivotal light bulb sort of moment. But it was also quite sad because it meant that I had to go back to my mother and say, turns out you were right, I do want to be a scientist.
Since then, Associate Professor Short has gone on to become one of Australia's leading experts on respiratory viral infections, such as COVID-19 and the flu. Her work has helped us better understand pandemics, including how we can prepare for future outbreaks.
One of the challenges about pandemic preparedness is we don't know what the next pandemic will be. Could be a coronavirus, could be an influenza virus, could be a completely new virus that we've never seen before. We don't know. So we really need to have things in our arsenal that work across multiple viruses.
That includes antiviral drugs that target features of a virus shared across multiple virus families. Associate Professor Short is also looking at mechanisms that target the host and help reduce the hyperinflammation associated with severe viral infections.
And specifically, they try and get that inflammation back in balance so that you've got enough inflammation to kill the virus, but not too much that you're getting tissue damage.
Her research also demonstrated a link between metabolic conditions such as obesity and diabetes and severe infection. Her team found that being overweight, obese, or diabetic impairs your immune response to the flu and COVID-19, meaning you're not only at higher risk of severe infection, but also at higher risk of reinfection.
But interestingly, that doesn't apply to the immune response to vaccination. The immune response to vaccination seems to be pretty consistent between overweight and healthy weight individuals.
It's work that she hopes will influence public health policy considerations here in Australia.
We now have a population where people are frequently living with one or more chronic medical conditions. We need to integrate that into our policy.
Collaboration is a key part of Associate Professor Short's work, and not just with policymakers.
It's really important to have clinicians involved because they've got the first-hand experience of treating patients. It's really important to have the patients themselves involved, in particular for conditions like long COVID, where it's really been patients who've been defining the condition and saying to the medical community, this is something important to look at.
Associate Professor Short says she's now thankful her mother pushed her to pursue a career in science.
Our experiences in science have been very different, in particular as women in science, because some of the discrimination my mother went through, I can't even imagine. And so I think she's really happy to see that sort of come full circle and that her daughter is able to succeed in this field now.
And in another full circle moment, Associate Professor Short has received the same honour that her mother did back in 1980, the Gottschalk Medal from the Australian Academy of Science.